You said at the press conference in Downing Street that your estimate was a 1% mortality rate. The Director General of the World Health Organization, I presume you were thinking about the UK, the Director General of the World Health Organization said that to date it's about 3.4% mortality rates globally. And I just wonder whether you could talk us through the modelling that gets you to that 1% figure.
I have a reasonably high degree of confidence that 1% is at the upper limit of what the mortality rate is, to be clear. What the Director General was reporting was essentially dividing the number of reported deaths by the reported number of cases and getting to a number. That isn't a mortality rate, that's just a percentage of people reported who've died. Now, what you need to do for this is there are several problems if you do it that way. And to be clear, I'm not criticising what he said. I'm just sort of saying the way it was reported made it sound rather different to what he actually meant by it. If you're missing all the mild cases, if you're missing all the asymptomatic cases, you inevitably therefore end up with an exaggerated view of what the mortality rate is. And in many countries, people are picking up the severe cases and the people who sadly die. If you just divide the one by the other, that does not give you a percentage of mortality rate. What it just gives you is a percentage of people who've died, who've been identified, which is a different thing completely. How you calculate it is quite a complicated issue, and it's different on the way up in terms of the curve and down on the way up the curve, which I could go into in detail if you want. But the modellers in the UK, who are the best in the world, in my view, certainly some of the best in the world, have looked at the data really carefully, and I think we are all convinced that the upper end of the mortality rate overall, in terms of people infected, is 1%. My own view is it may well be lower than that, because there may well be a lot of people who are infected and have no symptoms who we can't currently identify. It does start to increase above 60, a bit more above 70, and by the time you get up to 80, in Chinese data, mainly from Wuhan, which was a very, very heavily stretched health service, and these are big caveats, but let's just report the numbers as they are, the mortality rate looked as if it was around, somewhere between 8 and 9%. Put the other way around, that means that more than 90% of over 80-year-olds survived it, even in a stretched health service in China in this epidemic. So I think I know it is clear that the risk is very heavily weighted towards older people, but I think people translate that into, if I'm old and then I get it, I'm likely to pass away. Actually, the great majority of people will survive this, even if they're in their 80s.
What is the overall prevalence rate for the disease in Hubei province in China? What proportion of the population got it or have got it so far?
So the reported numbers, and you made at this point, I thought, very well on the radio, if I may say so, a couple of weeks ago, the reported proportion is probably somewhere around about 20%. And that contrasts to our reasonable worst-case scenario of 80% of people could get infected, which, again, we might want to come back to. But I think this raises three possibilities. The first possibility, which I think is highly, and these are not mutually exclusive, the first one is there is a large iceberg of people who've got asymptomatic infection, so a very large number of people have been infected in Hubei without being detected. The reason we don't detect them is we do not currently have a test which can say, a serological test, which can say this person has been infected even though they never had symptoms. And if I could, the one thing that would help me more than anything else in terms of planning for this, along with all my other colleagues in Public Health England and the NHS, is to know what proportion of people get this infection and have no symptoms at all. Because that would completely change the way, potentially, we think this is going to go. So that's one possibility. The second possibility is that the extraordinary efforts of the Chinese state have pushed it down to about 20%, but when they take their foot off the brake, the epidemic will then surge back again. That's the second possibility. And the third possibility is actually it tops out at a less than 50% for one of a number of epidemiological reasons. Now, any of those are possible. My own view is it's a combination of the first two, and what the ratio of some of the people who are counted as currently not having had it actually have had it, no symptoms, and some of it's to do with the remarkable efforts of the Chinese state.